Hi, guys. So it's Dr. Ryan, and today we're going to talk a little bit about a topic that comes up quite a bit for new patients, and that is onset of effects that come about with testosterone optimization therapy. And generally, what I tell patients is that things like improvement in sexual interest, improvement in your mood, so improvement of symptoms of depression, improvement in some of the inflammatory markers like CRP or high sensitivity C-reactive protein, IL-10, IL-6, TNF alpha. These tend to occur fairly early on in your therapy within 2 to 6 weeks, sometimes a little bit later, 2 to 3 months. And then things like muscle mass changes, increases in muscle mass, as well as improvements in bone density tend to take a bit longer, 5 to 6 months or a bit longer than that. But what I thought was kind of interesting is that there was a great review article that looked at all of these symptoms and surveyed hundreds and hundreds of papers that looked at a variety of symptoms associated with low testosterone or testosterone optimization. And I think the authors do a much better job of giving some specific data as to time periods as to when you should expect some relief. So let's go ahead and take a look at this review article. I'll share my screen here. And as usual, I have posted the link to the article in the summary below the YouTube video. And so this article, titled Onset of Effects of Testosterone Therapy and Time Span Until Maximal Effects Are Achieved in the European Journal of Endocrinology, was published in 2011. It's a great review article looking at many effects, of course, of testosterone optimization therapy. And so just as a basic overview, they looked at over 100 research studies via Medline search, and they spanned over 35 years and looked at many different clinical symptoms, lab values, and physical exam findings. And I urge you to take a closer look at this table, but this is just a copy of the table right here that looked at and some of the changes that they looked at in association with testosterone. So things like muscle mass and generally seem to increase anywhere from 0.4 to 16.4 kilos was the range in which they saw increases on individuals on testosterone optimization therapy. Strength in terms of certain exercises, there are increases in 1 repetition max, increases in bone mineral density, improvements in body composition. These are all negative numbers here, decrease of fat mass right here, improvement on lipids. They all generally seem to reduce total cholesterol, triglycerides, as well as HDL or improved HDL. And then improvement in glycemic control, glucose, fasting insulin, something called the HOMA index, the homeostatic model of assessment for insulin, for insulin resistance, and they also looked at blood pressure and inflammatory markers as well as hematocrit and hemoglobin. And I did a recent video talking about how testosterone replacement therapy affects erythrocytosis. I urge you guys to take a look at that. If you're curious on ways to reduce your hemoglobin, reduce your hematocrit, not have to give blood quite as often while on testosterone optimization therapy. Okay. So what they did was they compiled all the results in these great graphics. And again, take a look at the paper for some more information. This is a great graph. It's a set of concentric circles that describe certain aspects of increases in muscle mass and strength. And as you can see, generally around the 12-week period, increases in muscle strength and lean mass seem to come up, as well as exercise capacity. And this was measured by your VO2 max. And whereas things like bone mineral density, according to them, the maximum increase was closer to 3 years. Things like decreased fat mass tended to be a little bit in between, something about 24 months. They also looked at lipids, and as you can see over here, the onset was fairly quick, within between 3 to 6 months or so. And then the maximal effect appeared to be 12 months for total cholesterol, but 24 months for LDL triglycerides, as well as HDL. So it takes some time. Glycemic control, and again, these are markers indicating your risk for diabetes or insulin resistance, right? And some commonly measured markers include hemoglobin A1C, the homeostatic model assessment of insulin resistance, which is really just a model that incorporates fasting glucose and fasting insulin levels. And here you actually have insulin levels as well as proinsulin, which is a protein that's a precursor to insulin. And you can see all of them tend to have an onset that's fairly soon, between 3 to 6 months, and a maximal drop around 12 months, with fasting glucose taking a bit longer, with a maximal drop around 24 months. Then the time course of effects on sexual parameters. And as you can see, in general, it seems like things in regards to um, sexual interest and sexual thoughts, as well as desire, seem to increase fairly quickly within 6 weeks or so. Satisfaction as well as ejaculations appear to increase closer to 12 weeks, whereas things like erectile function in total, as well as number of erections, appear to be a bit longer. So erectile function seems to max out, say, about a year or so. So as a general summary, some of the timelines in regards to the more important effects of testosterone optimization include the following. So sexual interest, the odds are setting anywhere between 3 to 6 weeks, with changes in erection and ejaculations taking a bit longer, 6 months or so. Effects on your mood could be anywhere from 3 to 6 weeks, a max of closer to 4 to 6 months. The effects on your lipids started to appear after about a month, but maximally after a year, with insulin sensitivity improving very soon, but maximal effect really within 3 to 12 months. Inflammation, again, these are those cytokines, IL-1, IL-6, TNF-alpha, high-sensitivity CRP. These seem to cure fairly rapidly within 3 to 12 weeks. That's a decrease in those. And then changes in terms of your physique, decreases in fat mass, increases in lean body mass, as well as increase in muscle strength, seem to occur within 3 to 4 weeks, 3 to 4 months, and stabilize about 6 to 12 months out. And then bone density, which is also very important, they seem to be increased after 6 months, but maximal after 3 years. So that is a great article that kind of talked about some of those symptoms. One thing I will point out is that your personal results can vary significantly, usually for the better, if you adopt a diet as well as exercise regimen that is conducive to physique transformation. A diet where you emphasize lean proteins, complex carbohydrates, avoid inflammatory foods that are highly processed, gluten, dairy, foods that are higher in saturated fats. If you optimize other markers, other hormones, such as your thyroid, estrogen, and then if you make sure to also correct any vitamin deficiencies, you might find that your results can be much, much quicker. And in some cases, I've seen patients that have seen dramatic results within 3 or 4 months, adopting a very holistic approach. So just, an overall view was that whereas these researchers kind of gave you a baseline for time changes, they can occur much more rapidly if you take a more aggressive approach to your health, which is what I kind of encourage for patients in the clinic. Okay, well, hopefully this has been a helpful video on talking about when you should expect relief when you're optimizing your testosterone levels. And I'll see you guys in the next video.